lead up to the Evolve PEEF 2025 conference in October, we're excited to speak with experts in personal injury as part of the Studio PEEF podcast series. To kick off the 2025 season, we're joined by Dr. Ross Iles, Associate Professor and Chief Research Officer at Superfriend. Dr. Iles has an impressive history in the industry, working as the Deputy Director of the Healthy Working Lives Research Group in the School of Public Health and Preventative Medicine at Monash Uni, and is a driven individual to have a positive impact on the health of as many people as possible. Dr. Iles, welcome.
Thank you very much for having me.
Now, for those who are not familiar with Superfriend and the Superfriend report, perhaps could you help us frame what is that report and what is the data hoping to tell us?
Sure. So Superfriend is an industry super fund mental health initiative that was initially born out of effectively life insurers noting that people were leaving the workforce as a result of their mental health. And so there was an increase in claims as a result of mental health at work not being optimal. And initially, Superfund was born out of the need to increase the awareness of the importance of mental health at work. And I think it's fair to say the awareness definitely has increased, but unfortunately, so has the number of people unable to work as a result of their mental health. So it's really about now the focus is on how can you provide actionable insights. It's about what can we do about it. And one of the key things that we do is we communicate the information through our 5 domains framework. And our 5 domains are related to important factors in the workplace. Connectedness, which is about the quality of personal relationships at work. Leadership is about the ability of leaders to support and demonstrate their own care for mental health. We have work design, which really focuses on how things are arranged and done at work. We have capability, which is really focused on the real world ability to support mental health. Can people actually access confidential support? And then we have our safety domain, which is really focused on the protection from things like bullying and discrimination at work.
What type of workplaces or industries are reflected in the data? And within those references, what are the latest trends showing us across the domains that you've just specified?
So we actually capture information based on the 19 different industries that are established by the ABS, the Australian Bureau of Statistics. And within that, we actually capture a range of characteristics about those workplaces, if you like. So we have capture small, the medium to large in terms of the number of employees at the workplace. And we also can capture a lot of information that means we can dive down into the data if we need to. So, for example, if we're talking healthcare, we can talk about whether it's the private or the public sector. We can even narrow our data down to the not-for-profit sector. So we can actually dive deeper and deeper into the data, and we can also then dive into what's specific to a particular industry. And because we capture in 2024 more than 13,000 respondents in our survey, our data really holds the deeper that we go into it.
Seasonality is emphasised in the report as a significant factor into a healthy workforce, and that varied depending on the industry. Given that you had measured throughout the year, what has these results showed the Superfriend report is important for employers who could use this data for best results?
So one of the key things that we asked people was, what time of year do you feel particularly stressed at work? And we were able to then identify, well, when are the periods of the times of year that people are actually feeling under extra pressure or extra stress. And we found that there was a peak in June and a peak in December around Christmas time. And so one thing to be thinking about that is, well, the size of those peaks is different for different industries. But then also it means that we can prepare. So if we know June is going to be a busy period, well, then we can actually make sure that before we run into June, that workplaces are aware of what supports are available if they're feeling that extra stress and pressure. Or how do you cope when things are busy at work, but then something goes wrong in the background at home or whatever it might be? What are the resources that are available? And making sure people are aware of those resources before those busy times, if you like.
When we think of safety across industries, we can ably speak to physical hazards that may be part of that industry. So, if you're in health, you're thinking about all the safety precautions you have against infection or against, protecting the patient, but also protecting yourself. If you're in construction, there are hard hats and high vis and all sorts of things. I think that across the board, when we think of our physical hazards, it's a very comfortable space, and employers will do everything that they can to assure the physical safety of their employees. However, you've touched on the psychosocial hazards that exists, and with the rise of psychological injury claims in the workforce, what, from your perspective, based on the data-driven insights the Superfriend report has offered, what should workplaces know about psychosocial hazards?
When it comes to psychosocial hazards, I think for an employer, it's very easy to get lost in the amount of information that's available. So in the most recent National Psychosocial Code of Practice, there are 17 different psychosocial hazards that an employer is responsible for. And that's an overwhelming number. But realistically, when rather than getting lost in all these 17 different things that I need to be mindful of, it's to actually take the time to think about what is it that we're asking our employee to do? What's that person required to do in their job? And thinking about, well, what are some of the stresses and the pressures, some of the things that you can't see easily that might pose a problem over time. And then you can use those 17 psychosocial hazards as a bit of a memory jogger or something that will get you thinking about what are some of the challenges that could be part of this role that we might not think about because it's the way we've done it since day dot. And I think for employers, it's to actually demystify things a little bit and not necessarily feel like you need to spend hours and hours learning and understanding about these new things. You know your workplace, you know your employees, you're the expert in what needs to be done. These things are there to help guide you to think about how could we do this so that my employee is safe and doesn't actually have negative implications of doing that job regularly.
According to the research, leadership, and as you've mentioned regarding psychosocial hazards and how employers should be approaching that by being quite aware and clear of the tasks that their employees required to perform and ensuring that they do feel safe and able to be able to complete that task and really setting them up for success. Now, leadership is a core driver for change to support better mental health in the workplace and, importantly, to remove the stigma around mental health. What advice would you give leaders struggling in this space?
I think what we see is that leadership is becoming more and more complex. We know that there are the challenges of running a business, so the business works well, but now there's that extra layer of protection that we need to be mindful of with our employees. I think one of the strongest recommendations you can make, or for leaders, is to actually clearly demonstrate how they care for their own mental health. And it's sometimes it's making a fuss of actually putting your hand up and saying, I've had enough today and I'm going to finish early, or giving permission for people to actually recognize that, well, this is how things are going today, and it's not always going to be perfect every day. But to address that stigma component, for leaders to show that they're human. And sometimes if leaders have been in their leadership positions for a long time, there might be that that thinking that they got there because they worked through all of those problems. And that's something we need to get away from, as to that you got where you got to. How did you manage those problems? They're not new things. People aren't facing things that are potentially different to what you did. We need to embrace that openness of talking about it and demonstrating that it's okay to not be okay.
I think that is an absolutely wonderful message. Certainly, as a leader myself, having a duty of care for other people is something that I take very seriously, and I'm certain that all productive leaders and leaders who lead with vulnerability would agree that looking after their employees is paramount to them. It's not something that they feel that they only have to do. It is something that they are sincerely wanting to do. And sometimes that task, as you mentioned, leadership has become more complex. It can be a delicate balance between showing that vulnerability and being able to lead your team effectively and ensuring that they have utmost faith in you. And I think leading by example and showing them that you're okay to show your vulnerability when you need to, that you're fully supportive of all of the supports that might be available in your organisation to lean into when you need it, which could look like a flexible work arrangement, or perhaps it could look like tapping into your organisation's EAP, and putting up your hand with some lived experience. Could certainly take some of those barriers, those uh, I guess almost conceptual barriers down, to say that we are human, we're all part of a human experience. We're all here and aiming to do the same thing, which is to serve others, to work hard, to work together as a team. Sometimes a team member may be down, and what can we do to purposefully and deliberately show how that can be cared for, with compassion, with understanding, and with support to keep doing a good job. Now, we did touch on the different domains and we talked through connectedness, safety, leadership, capability, work design, and we have talked a little also around how we can use that data to either front end or adjust a workplace strategy or opportunity so that we are setting up our people to thrive in the workplace. I can see some themes coupling together quite well, leadership and capability being one, leadership and connectedness as well, because we certainly all have a responsibility to ensure that our people feel connected to their workplace, and leaders often, lead that connectedness by making sure that their people are feeling welcomed, supported, respected from a diversity and an inclusion perspective. Of all of those domains, is there anything in your perspective that ought to be receiving priority attention, or can you speak to any of those couplings or linkages that you see?
The other, I mentioned another way to look at that is we've done the analysis, the multivariate analysis, looking at multiple data points all at the same time. And across our 5 domains, they independently predict different outcomes. So, for example, connectedness was the sole protective factor when it comes to psychological distress. So, psychological distress is that generalized stress and anxiety that people feel, and having good relationships at work was the most protective factor amongst in the data that we collect. Whereas something like leadership is actually protective against burnout. So if you've got a strong leader, and you're much more likely to be able to address burnout because the leader is going to identify some of the systems that are impacting burnout, but then also recognize the signs and be able to respond. So across our 5 domains, we actually see that they independently predict different outcomes, and that's where we think our framework is a really useful way to be able to identify what can you actually do in the workplace to actually improve outcomes for your workers.
Are there any, outside of the amazing takeaways and the gold that you've provided here, are there any other key takeaways, or it's a key message perhaps, that you would like employers to walk away with?
I think the key message from our report is that we are looking to generate the data that means we can be proactive when it comes to looking after our employees at work. And that's what we want to really emphasize, that it's an ongoing process. It's not you can do it once, you can cover your psychosocial hazards. It's actually something we do need to be mindful of throughout the year, but we can prepare. So we won't be caught unawares. And the only other point that I'd like to make is that here at Superfriend, we're measuring what's happening at the workplaces. We know that there are events that happen further down the chain, things like having to leave work, using sick leave, maybe making a workers' compensation or a claim under life insurance. And we really want to unlock what are the things that we can measure at the workplace that might give us some clues to identify those people who might actually need that extra bit of support to avoid having to leave the workplace to address their mental health. Because we know being at work is good for your health. And so we want to identify what are some of those things that we can pick up early. That means we can actually provide the best possible supports for those people so they don't necessarily have to leave work, or if they do need to leave work, that it's only for a short period and we have them back on board and healthy and thriving again as soon as possible.
Thank you so much for your time, and you have yourself a wonderful day.
Thanks for having me.